Angie's List is now Angie, A-N-G-I, and caring for your home just got easier. Whether you need help with routine maintenance or a dream remodel, Angie makes it easy to see reviews, compare quotes, and connect with top local pros who can get the job done right. Plus, you could see upfront pricing and instantly book hundreds of projects. No phone tag, just the work you need done at a time that works for you. Angie's got your to-do list covered from start to finish. Book your next home project today at Angie.com. That's ANGI.com.
Look, staying healthy isn't easy. Watching your diet, hitting the gym, avoiding stress. But a good night's rest helps boost your overall health and wellness. And it couldn't be easier. The Sleep Number 360 Smart Bed effortlessly adjusts and responds to both of you. The result? You wake up ready for anything. Proven quality sleep is life-changing sleep. And now save $1,000 on the Sleep Number 360 Special Edition Smart Bed, only for a limited time. To learn more, go to sleepnumber.com.
Welcome to the Beverly Hills Plastic Surgery Podcast. This is Dr. Jay Calvert and Dr. Millicent Ravello coming to you from the 90210 to discuss male facelifts.
Good evening. How are you?
I'm good. You ready?
I'm so ready.
All right. I know you saw a ton of people today.
Yes.
So that's good. And it's time for us to talk about male facelifts.
Male facelifts are definitely a different variety than the female facelift. Although the techniques are more or less the same, it's just different. It's a little bit different.
Yes. First of all, I want to start with there is no such thing as a male facelift. Because if you say that word around a dude, they are not signing up.
True. It is, what are we calling it these days?
I call it a neck lift with an upper facial extension. And that seems to go over just fine.
That goes over better.
But my last patient said, you got to go one further. Just call it like the Newport Refresher or the Beverly Hills Refresher for Men or something along those lines. Because the term facelift has bad connotations with men.
It does. They don't want to be known as the dude that got a facelift because that has, you think of women getting facelifts or just someone who's going to end up looking weird and freaky like the other men they've seen that have facelifts. So yes, I can definitely see the apprehension on their part for why they wouldn't want to be getting a facelift.
However, that's what it is.
However, they are getting a facelift.
Whether they like it or not, that's what it is. And the reality in my world is that a male facelift is very different than a female facelift because, first of all, there's the beard.
There is a beard.
The beard, the hair, makes the skin a little bit more difficult to manage, number one, but also it makes it a little bit more vascular.
Like
There's
a lot
more blood.
Well, and the fact that men probably have a little bit higher blood pressure issues than females do. So that, combined with the hair follicles, can definitely make for a little bit bloodier procedure.
True. So there you are. You're doing your male facelift. And the biggest thing that comes up in my mind is the direction of the lift. Because the last thing you want as a guy is to look like that wind-blown, through the wind tunnel dude who had way too much tugging
Plastic
on
surgery.
his skin.
Yeah. Right, and it tends to feminize them.
Yeah.
And that's not the look they're going for. They want to look like themselves. They want to look like men, just refreshed.
That's why it's called that, Millicent. We've changed the entire name. That the male facelift does not exist. It's like a unicorn. So the things that I notice, first of all, a lot of plastic surgeons want to do this cut in front of the ear because there's a crease there, and typically in the men who are having facelifts in their late 40s, 50s, or 60s. But I don't do that. I don't like to put the cut, the incision on that crease because I think you can see it.
You can see it. You can definitely see it. I see the temptation because that crease is very much there and prominent, and it's like, oh, it's right there. Why wouldn't I put the incision there? That's
right.
But once you've done the facelift, that crease kind of goes away, and now you see the scar.
So I always do the retrotragal approach. And, they say, well, what about the hair? Well, first